Hello and welcome to week 5. This week I feel it's pretty straightforward as far as your discussion board and your assignment. We're really focusing on the whole healthcare team and a multidisciplinary approach and change that comes with it. If it's one thing that we know in the nursing field or in the medical field in general, change is happening all the time. We cannot get away from it no matter where we go. Either it's a change in your procedures or it's a change in paperwork, it's a change in assessment, but we're changing all the time. And throughout all of the years that we have been in practice and prior to that, we have seen how important it is that we all work together, whether it's the pharmacist collaborating with us and us collaborating with physical therapy and on down the line. We need to be together. And that has been tremendous changes over the past few decades, basically. So let's look at your discussion board first. Locate an article that discusses the importance of collaboration within the healthcare team. Summarize the article and then discuss how collaboration with a multidisciplinary or interprofessional team has helped you grow as a nurse and helped your patients. You've all benefited from that. You've all been a part of that. So take a look at that. First, again, analyze your article and then talk about how this has impacted you as a nurse or your patients. Then with your assignment, we're moving back to a PowerPoint. So if you need to refer to the posts or the news posts that I have had previously about PowerPoints, please do so, just so you can make sure you don't have some of those same mistakes in this assignment. All right, you've been asked to implement a new computer charting system within your hospital. The staff at the hospital has been using paper charting and the staff's age range is from 20 to 72. There's going to be a few things that you need to address. And it's funny, a lot of students will say, well, who does paper charting anymore? And I'll be honest with you. I still work at Keystone Treatment Center every once in a while, and they still do paper charting there. It is a culture shock to some of the students that go there, but they still do paper charting there. They're trying to get a computer system going, but they're running into some roadblocks. So if you were to be at this facility that does paper charting, what do we need to deal with? Well, in the PowerPoint, these are some of the things we want you to look at. Who would you want on your team to help you implement this change and why? I think of Keystone. Two of the big bulks of staff that we have there is nursing and counseling. And there's, other staff, but those are going to be your big ones. So think about if you were implementing this at your place of employment, who would you want involved with this? Because everybody's going to be charting in this, and what would benefit everybody? What should you consider when communicating this staff to change, and how should the change be communicated to staff? If it's anything that some people hate, it's change. It's just you get into a routine and you don't want that routine to be altered. So how would you like to be communicated about change that's coming? Are you more of a person that is just going to directly tell them this is how it's coming, or do you want them to buy in somehow? Buy-in is usually the best, but sometimes it's not always the easiest thing to do either. So how would you handle communicating this to the staff? Third, how are you going to implement the change, handle resistance, and be the change agent? You know you're going to have resistance. That's just a fact of nature. You're going to have that in some of these situations. But how are you going to model being a change agent? They're going to have to see you use this and like it and engage in it. How are you going to handle that? What issues do you need to address about the use of technology within the hospital, such as security, website surfing, and documentation? Website surfing is an issue probably anywhere we go. Some facilities allow you to get on any kind of site, some facilities don't. But think about those types of things. Maybe go to your place of employment and ask what provisions do you have in place for security, and what do they allow as far as you surfing the internet, and what don't they allow? What types of technology would you like to see? Now, most facilities have laptops or personal computers, but are you seeing more iPods come into place here? Okay. Or iPads, sorry, tablets. How do you address the concerns of your older staff who do not have a computer and are scared of them? These are probably going to be people that you may need to spend extra time with. You may have to have smaller sessions with them over a longer period of time, allow them to practice more. because it is difficult for some of the older population to engage in this. I know my mother, granted she's 90, but she's smart as a whip yet, but she cannot understand how to use computers or iPads. She just doesn't get it. And I know you're not going to have anybody at that age on your staff. I'm just using that as an analogy. You are going to have people who just do not embrace even cell phones. They might not even own a cell phone. So to move to this type of system and documentation is going to be a culture shock to them, and they may actually consider a different job. So how can you help them stay in this position and get through that? All right, your PowerPoint should have 3 outside references and your textbook, so a total of 4 references. It should include a title and a reference slide and be anywhere between 14 and 20 slides. If you have any questions about the assignments or the discussion board this week, please feel free to reach out to me. Have a good week.